Sangeeta, if you can tell us, you've also been a part of this campaign since the very beginning. Thank you for always supporting it. How can the private healthcare sector in India contribute to developing innovative local solutions that have a global impact?
So let me begin by congratulating all of you. It's been 11 incredible years of Banega Swasth India. And so congratulations. I'm glad that you brought the conversation on healthcare center stage. I believe that private healthcare has a tremendous role to play in that first, we need to create the infrastructure to treat and cure and heal people so that they, number one, get better, they have access to healthcare. But also when Apollo Hospital started 41 years ago, our ideology was to give Indians healthcare, advanced healthcare within the reach of people and obviate the need for people to go abroad for advanced healthcare. I'm happy to say that, the role has reversed and now we have patients from 140 countries coming to India for treatment. But the role of private healthcare can actually go beyond. And I think we have a very critical role to play in public education. Most of us use our CSR money towards prevention. And I think large-scale screening programs, building awareness, and of course, you have been a part of our journey in our rural endeavor. But to reiterate that, in the village where my father was born, we take care of the health, that is from birth through life, of about 68,000 people. This began about 20 years ago. We first took care of the social determinants of health. So clean drinking water, sanitation, nutrition. We then put up a hospital there so that they had immediate access to care. That hospital was connected with telemedicine so our advanced doctors could meet and advise whatever was required. Then we went on to create the first passport to health, which was our health insurance card. And this was 24 years ago. Once we had covered the whole village, we then went on to look at capturing the data in the WHO STEPS methodology, creating preventive healthcare programs like screening for cervical cancer, awareness about breast cancer, prostate cancer, simple things like cataract surgery, but also the most pervasive problem of blood pressure and diabetes. So by monitoring these, taking care of them, giving this good health and nutrition, I'm happy to say that now this model has really shown that it works. And in a recent study which was done, the incidence of disease is lower in the cohort of 68,000 people who live in the Tavanampalli Mandal cluster than in the neighboring mandals. So this is proof that science and working together and partnerships, we have multiple partnerships who are helping us make this village become among the healthiest village clusters. So awareness, effort and partnerships can make an impact and save lives and keep people healthy. So I want to congratulate all of you for the great work that you do in making the dialogue of healthcare center stage. And I will also say that there is, so much more work to be done. There's vaccination, whether it's, pediatric and adult vaccination. There are children who are still undernourished. There's need for emergency access to care. We should not lose people with heart attacks. And most importantly, I want to call out Pro Health, which is our health checkup program. I request everybody to please have a health checkup and find out a problem when it's in a minor stage without waiting for it to become a major problem. So these are, multiple dimensions. I know I've given you a fairly long answer, but the ambit of healthcare really spans from prevention, health infrastructure, to emergency care, and then to science and new discoveries. So, and we have to keep on working on this, putting our beautiful scientific minds, technology and AI, public awareness and communication, all of us have to work together because health is really the community's responsibility.